Kính thưa quý vị, tôi là Mỹ Linh Phạm và tôi là giám đốc của Trung tâm Cộng đồng Á Mỹ. Thưa quý vị, chúng ta đang sống ở trong một thời điểm có rất là nhiều tai ương và giống như bệnh dịch đang xảy ra. Nếu quý vị có thắc mắc hoặc là cần sự giúp đỡ, quý vị cũng có thể liên lạc với các cơ quan như là American Red Cross hoặc là Catholic Charities. Quý vị cũng có thể ghi danh vào chương trình Alert SCC của quận hạt Santa Clara để tìm hiểu thêm về chi tiết và cũng như để biết khi nào chúng ta cần phải để ý đến những cái vấn đề đang xảy ra. Quý vị có thể thắng một cái gift card là 25 đồng nếu quý vị vô trong cái chat và đề chữ tôi hiểu. Xin cảm ơn quý vị. Back to you, Anna.
I don't see very many responses to my Lynn's instructions. Oh, wait, you didn't understand the instructions and what you were supposed to do? What if this was a real emergency and you missed out on important instructions and resources? It's stressful and uncomfortable. And this is what people go through every day who don't speak English or are not fluent in English in our community. So for those of you for whom Vietnamese is not your preferred language, the message My Lynn just shared will be repeated in English at the end of this morning's session. So stay tuned. We'll catch you up at the end of the session on this important information. And for those of you who didn't understand My Lynn's instructions for her request, if you want to know more about the gift card, stay tuned for the message at the end of this session. Good morning and welcome to the 2022 CADRE Symposium, A Day in the Life. My name is Anna Swardensky and I'm CADRE's Director of Planning, Training, and Community Resilience. Here at CADRE, we recognize that there are many challenges we all face as a community when an emergency or a disaster strikes. The theme of this year's symposium is A Day in the Life, and we welcome you to our opening session. As we get underway with our welcome and introductions, please do the following housekeeping tasks. Let's have everyone put their name and organization and one word or two about how you felt during our opening segment that was offered in a language other than your preferred language. And then if you could also change your Zoom window ID to reflect your first name and organization, that would help. One of the challenges we face related to communication is the information being shared accessible to all who want or need it. As you just experienced in our opening segment, not everyone in our community is able to receive information in the way in which it's most comfortable or easily accessible to understand. As a whole community, we've not solved this challenge fully, but we're committed to doing better. So for today's session, and for all of our 2022 CADRE Symposium sessions, we're offering the following. There's Otter, AI, and Zoom live transcription running. And in your participant window, I should be at the top of your box with an access/TA notation. Marcia Hovey and I will serve as the access coordinators for your sessions throughout the symposium. Please note that we are recording the session, and we ask that whenever you are speaking aloud that you please turn your video feed on also, so we can not only put names and faces together, but that will assist with communication accessibility. And so with that, I want to turn the program over now to Marcia Hovey, the director of CADRE.
Hi, good morning, everyone, and thank you for being here this morning for our kickoff meeting. We wish we could be with all of you in person and do this in one nice long one-day session, but we're not there yet. And so out of an abundance of caution, we're spreading it out over 3 days and keeping you all safe in your offices or at home. Disasters are challenging for everyone, especially for those with access and functional needs. And we at CADRE, as the local VOAD for Santa Clara County, we adhere to the concepts of communication, coordination, cooperation, and collaboration to ensure that we're solving problems with all of the players in the room and reaching successful outcomes that impact our whole community. And so that's what this series is all about, is to focus on disasters from community members' perspectives and explore how we as a whole community can better serve all those disaster survivors. And then through this process of the next 3 days, we will have interactive scenario-based discussions on different aspects of disaster response, whether it's communicating with people or setting up a shelter or temporary evacuation, or no, we skipped that one, disaster recovery and points of distribution. Each one of those has different challenges for different people. And so we're just going to spend our time discussing with all of you, the subject matter experts, and working together so that we can ensure that the next time we have a disaster, we do better. And that's our goal, is that every time we have a disaster, we do better than the time before. Next slide is the agenda. And you can see we're well into the agenda. So the next thing that will be happening is a presentation from Sherry Burns from the Silicon Valley Independent Living Center. And she will be speaking to give us an overview of CMIST, and she'll explain that. But we're using Sherry because she is one of the subject matter experts in Santa Clara County for access and functional needs. And the CMIST categories are our model for emergency planning related to access and functional needs. We'll do breakout sessions. We're going to have some plenary discussions, and then the closing comments where we'll wrap up the day and transition. This afternoon, we will be delving deeper into to one of the aspects of disaster response, and hope that you can join us then. And then just a reminder again to make sure that you stay tuned to the end, because you don't want to miss what's happening at the very end. So please stay with us, and we will get the recording posted as soon as possible for those that missed the beginning, but it probably won't be before our 1 o'clock session. All right, and so I'd like to introduce Sherry Burns, who is the Executive Director of the Silicon Valley Independent Living Center. Sherry.
Good morning, everyone. Oh, next slide, please, Marcia. Or there we go. Thank you, Anna. Good morning, everyone. And thank you, Marcia, Anna, and Mylin for our opening to this year's CADRE Symposium. I don't know how you all felt during the welcome and opening in Vietnamese, a language I don't understand personally, but I felt lost. And I'm very intrigued about the gift card message from Mylin. So definitely will want to stay till the end. Still, the exercise gave us all a sense of what it's like to feel lost and perhaps ignored because we don't speak or understand the quote unquote default language, or aren't familiar with the predominant culture, or aren't able to see, hear, or understand everything clearly, or aren't able to walk or run. As Marcia shared today and over the next 2 days, we will all have the opportunity to put ourselves in another person's shoes, to experience what it's like to have one or more barriers to work through during an emergency or a disaster. And just as importantly, to problem solve how to mitigate, address, and even remove those barriers. Because when we work together to help everyone in our community through an emergency situation, we can all succeed. Next slide, please. So Marcia mentioned CMIST, which is what I'm going to cover this morning for the next couple of minutes. This is a framework that we'll be using throughout the next few days. CMIST is an acronym and a memory tool to help people remember and plan for the 5 functional needs individuals may have in an emergency or disaster. Those needs are C for communication, M for maintaining health, I for independence, S for support, safety, and self-determination, and T for transportation. Developed developed by disability policy consultant June Isaacson-Tales, who will be our keynote speaker tomorrow. The intent of CMIST is to foster better understanding of who is included in the large numbers and diversity of people with disabilities and others with access and functional needs who need equal access, and to build competencies for emergency personnel in implementation of physical, programmatic, and effective communication access accommodations. CMIST is a function-based approach to include people with disabilities and others with functional needs in emergency planning, response, and recovery. The intent is to accurately guide and increase clarity regarding including the emergency needs of a large segment of the population in planning and service delivery. Next slide, please. So who are we with access and functional needs? We may know that persons with disabilities may include those with hearing loss, deafness, developmental and intellectual disabilities, learning difficulties, low vision and blindness, and mobility difficulties. But who else might have a functional need that we must include in emergency planning, response, and recovery? And on this slide, there is a photo of 4 individuals with various disabilities, some visible and some hidden. There's a woman seated in a rollator walker with her arms up, a gentleman standing with a white cane, a woman with a colorful top on standing, and a gentleman to her left or on the right side of the screen in a power wheelchair with his hand raised. Next slide, please. All right, who else are we besides people with disabilities, both hidden and visible? How about young children and older adults? How about individuals who are unhoused? How about individuals who are transportation disadvantaged and people with limited or no ability to speak or to read English? When we consider that all these residents combined actually make up more than half of our population, we aren't talking about a small group of folks with so-called special needs. We're talking about our entire community. Next slide, please. So back to CMIST. As I mentioned before, C equals communication. On this slide is a cartoonish drawing of a man and a woman who are talking to each other through the way that a lot of us as kids played with, which was a can or cup that were attached by a string. And so one person is talking, the other one is trying to listen. Individuals with communication needs may speak American Sign Language or ASL, have limited English proficiency, use Braille, or use other auxiliary aids and devices to communicate or to navigate their environment. These individuals may have limited ability to hear announcements, see signs, understand messages, or verbalize their concerns. So what might you consider if someone has limited English proficiency and is being directed to relocate to a temporary evacuation center? You can put your recommendations in the chat or unmute your mic and for a few seconds, share them out loud. Let's see what we have in the chat so far. What might you consider if someone has limited English proficiency and is being directed to relocate to a temporary evacuation center? Any ideas? Sheridan Lane says, using the language line. Cher from the city of San Jose, interpreters. Liz with CADRE and Red Cross, use picture translator. Excellent suggestions, thank you. So yes, a couple of ideas would include providing a translator to facilitate appropriate person-centered planning, either in person or virtually. Perhaps using a smart device translation app or Google Translate in a pinch while you're waiting for a language translator to show up. Also have written materials in multiple languages that convey necessary information in plain language. Thank you for sharing your thoughts on that. And the last possibility might be making sure that the evacuation center has both directional and icon sign language, such as what Liz recommended with pictures, that can be understood by everyone regardless of their primary language and for those who are unable to read. Next slide, please. M in CMIST means maintaining health. Individuals may require specific medications, supplies, services, durable medical equipment or DME, electricity for life-maintaining equipment, breastfeeding and infant child care, or nutrition in order to reduce negative impacts of a disaster or public health emergency on the individual's health. In this photo slide, we have a hand outstretched with several different shapes and colors of pills, medications, and a daily medication box on the person's lap. And then the other photo shows a person, just the lower half of their body, their legs. One is in a sports shoe and the other one is in a very complicated looking walking cast, and the person is using crutches. So what might you consider if someone has one or more chronic health conditions? You can put your recommendations again in the chat or unmute yourself to say them out loud.
Sherry?
Yes.
This is Christine.
Yes.
I would say ask about the medication and even help label things if needed.
Great, thanks, Chris.
Yep.
Any other thoughts? And again, you can either use the chat or unmute yourself. Susie, food prep safety for allergies and sensitivities. Thank you. Jenny writes from Red Cross, how portable is their DME, their durable medical equipment? How replaceable is it? Is it something that we can replace for them? Okay, great suggestions. Thank you. Here's some others. Ensure that they have access to their appropriate medications or therapeutics, including their durable medical equipment and assistive devices. Make sure that a pharmacist is available to refill prescriptions. So if they have their prescription information with them, then a pharmacist can verify it and refill it. Make sure refrigeration is available at the temporary evacuation center or the shelters for those needing to keep their medications cold. Next slide, please. Oh, before I move on, Sheridan suggests in the chat ADA cots. So the cots that are a little higher for making it easier to transfer. Most cots sit at about 15 inches from the ground, which is way too low for most people to transfer from a wheelchair back and forth. And so the ADA cots are closer to 19 or 20 inches high. She also says plugs for CPAP machines, et cetera, VTA route to local pharmacy, disaster health services. Thank you, Sheridan. Excellent suggestions. The I in CMIST. When relocating adults with disabilities to temporary evacuation centers or longer-term shelters, it is crucial to ensure continuity of access to necessary mobility devices or assistive technology, vision and communication aids, service animals, and caregivers that can assist the individual in maintaining their independence. This slide shows a teenager or preteen girl in a power wheelchair, excuse me, with a blue jacket on and a yellow baseball hat, and she is hugging her golden retriever service animal. She's got a big smile on her face. So for independence, what might you consider if someone has a service animal and needs to go to a Red Cross shelter? Again, you can put your thoughts in the chat or unmute yourself. What might you consider if someone has a service animal and needs to go to a shelter? Any thoughts there? Share with the City of San Jose Emergency Services easy transport for the service animal and their owner. Yes, keeping them together. Thank you. Food supplies ready if needed. Food and toileting for the dog and the owner. Thanks, Liz. Great suggestions. Paul says supplies of food, waste disposal bags, etc. Yes, great suggestions. Rest facilities for the service animal from Rich.
Sherry?
Yes, Chris.
Also considering medications that the animal might need too.
Absolutely. So it's important for those of us who have pets, and especially for service animals, to have all of their veterinary information readily handy and part of our to-go kit. And that will be helpful too. Sharon writes, placement in the shelter, accessible route to outdoors, low distraction with curtains between beds for the pet. Jenny asked, does the shelter have space both for the service animal and the owner? Pathways that can be navigated. And Fernanda writes, a crate for the service animal. Excellent, excellent ideas. A few others, again, that you already alluded to that I wrote down: ensure the service animal can be kept with this individual. So co-locating animal services for sure for pets, but service animals have, by law, have the right to stay with the owner. So you still need to have some basic supplies and resources planned out so that individuals who utilize a service animal can stay with that service animal and maintain their level of independence. Things that you already talked about too, providing water and food for the service animal if the individual had to evacuate without those items, and provide for a safe, appropriate outdoor place for the animal to go to the bathroom. Thank you, everyone. Okay, we're getting close to the end here. Next slide, please. S stands for support, safety, and self-determination. Early identification and planning for access and functional needs can help to reduce the negative impacts of a public health emergency on an individual's self-determination and general well-being. Some people may have lost their caregiver assistance during a disaster and require additional support in a shelter or a new environment. Some individuals may find it difficult to cope in a new or strange environment, or have difficulty understanding or remembering. And some individuals may have experienced trauma or be victims of abuse. As a result, they may need additional personal care assistance, experience higher levels of distress, and need support for anxiety, psychological or behavioral health needs, or require a trauma-informed approach or support for personal safety, health, and their welfare. Such support should be provided with deference to person-centered planning and decision-making with the individual. In this slide here, I have a picture of two children who are sitting on a sidewalk, crisscross applesauce, kindergarten manner, and they're leaning into each other, smiling, and they're each holding, excuse me, they're each holding a book. And one of the books that the child is holding is titled Cuddle Bear. So what might you consider here if the individual has been separated from their family or caregivers during an emergency? The individual may experience increased anxiety or other psychological distress and therefore need additional behavioral health supports, such as a counselor or clergy person. Consider that the support is delivered in an accessible, culturally competent manner. If you have other thoughts, you can put those in the chat as well. If the person is an adult, consider providing interim caregiver assistance if requested. And if the person is a young child, consider providing a comfort animal, a stuffed animal, or a blanket, or offering toys, coloring books, or video games for comfort and for distraction. Sheridan puts in the chat a question: how can you elaborate on person-centered decision-making? I think that's a really cool concept. Yes, thank you for asking that, Sheridan. Just real briefly, I'll say person-centered planning and decision-making means is that the person who is being affected by the situation is at the center of their own determination, their own planning of what works best for them. It's not me coming in and saying, you know, I think this is what you need. It's sitting down with the person and finding out what their needs are in their own words and what is also a suitable mitigation to help them. Now, obviously, with a child who is not accompanied, you might ask some guiding questions to find out a little bit more about them so that you can figure out with them what would be a good method of providing them with comfort and support during this time. But again, you want to make sure that the individual is determining what their needs are and what will best meet their needs. Thank you for asking that question, Sheridan. Susie writes, if possible, you may want a quiet space away from the external chaos. Absolutely, so important. During the pandemic, the San Andreas Regional Center and Silicon Valley Independent Living Center worked collaboratively with Safeway Pharmacy and the city of San Jose to provide a vaccine site over at the regional center offices. And we had a screened area that individuals who needed a quiet space and, you know, not public eyes on them while they were getting vaccinated, to be able to be over there with their caregivers or their service animal, and so that they were in a comfortable situation. We also had some toys and other things over there to help some of the individuals during that time and make it easier for them as they were preparing for their vaccine. And last, next slide, please, is T for transportation. Lastly, individuals may lack access to personal transportation, be unable to drive due to a decreased mobility, and that may come with age and or disability, temporary conditions, injury, or legal restrictions. Disasters and public health emergencies can significantly reduce transportation options in some communities, inhibiting individuals from accessing services and staying connected. Disaster planning requires coordination with mass transit and accessible transportation service providers. In this slide, here's a picture of a VTA bus that has a lift. It has one middle door open for entrance, and then in the rear has a hydraulic lift, which two gentlemen are standing on and strapped in with a nice bar to hold on to as it's raising them into the level flooring of the bus for safe and easy access. So what might you consider here if an individual requires transportation to a temporary evacuation center or a shelter? What might be some of the things that you'll consider making sure is provided for folks that are transportation dependent? Cole writes here, immune compromised folks still need more support versus multi-person vans that aren't safe for immune compromised. Yeah, so maybe even having a private option, absolutely. Paul asks if we need to go out of the area, how do we get there? Well, it's a good question. Any other thoughts? These are things that need to be problem solved, and we will be doing a lot of that over the next couple of days. So here are some initial thoughts to get you thinking. Provide information about accessible public transit bus routes. So if you have a shelter site or evacuation center set up, make sure that the communication going out indicates what are the public bus routes that can take a person there. Also connect the individual to alternative transportation services that support their independence, such as accommodations for durable medical equipment, mobility devices, or their service animal. That could look like arranging for paratransit services, a private lift-equipped transport, or volunteer car sharing services. Next slide, please. So hopefully this overview of the CMIST framework will help guide you over the next 3 days while collaborating with others in the breakout room exercises, where we'll look at how we can address the access needs of everyone in our community during and after a disaster. As you work through incident scenarios and journey mapping, consider what might be necessary for each individual with regards to communication, maintaining health, independence, support, safety and self-determination, and transportation. And more importantly, use the CMIST framework to consider where we all need to do better and work more collaboratively in our disaster planning, response, and recovery to make sure that everyone is included and thrives. Thank you. Back to you, Marcia or Anna.
It's back to me. Thank you, Sherry. That was a wonderful overview. What we're going to do now is we're going to walk you through how the rest of the symposium is set up. So what you have seen, hopefully through your registration, is how this year's event is structured. Think of this as a virtual conference that's being spread out over 3 days with 2 90-minute sessions to be held each day. After this morning session concludes, we'll reconvene at 1 p.m. to get into our first day in the life discussions in small groups. The first session is themed around the alert and warning phase of a disaster. Then continuing on tomorrow morning, the next set of small group discussions will focus on response and relief. And starting at 11 a.m. tomorrow, we have an amazing keynote session speaker planned for you that Sherry explained. June Isaacson-Kales, the creator of the CMIST categories and functional assessment service team planning, will be joining us to share with you her thoughts, experiences, and recommendations. So you really don't want to miss that session. And then finally, on our third day, we will begin again at 9 a.m. with the last of our small group discussions focused around recovery. Our event for this year will close out on Thursday afternoon at 1 p.m., where we'll bring together the information and ideas from all 3 days this week. We do have a panel of speakers also planned for our closing session from our local jurisdictions here in Santa Clara County, who will share with you the work they're doing related to our theme and our symposium objectives of meeting the needs of our whole community. And so with that structure, let's move on to a few details of how the small groups will actually work and are designed. The discussions when you go to small groups will be, oopsie, hold on, lost my notes. The discussions, remember, our goal for this year's symposium overall is to focus on disasters from different community perspectives, to explore how well we as a whole community are serving the needs of our diverse Santa Clara County community, and to engage in interactive scenario-based discussions so that we can identify challenges and possible solutions. So in each of the breakout rooms, you will be using personas to move through your discussions based on the particular phase of the disaster scenario. The personas will be shared with you in your small group rooms, and you will choose who you want to be for that day in the life for each session. The personas were designed around the CMIST categories of needs that Sherry just explained, and you're free to elaborate on them as you play your role in the discussion. In fact, we want you to embrace these roles and add your own depth and nuances to them based on your own personal lives and experience. The discussions will also be using Google Jamboards to help our facilitators and your group follow along with the discussions and capture important notes for future planning. If you could use your emojis in your Zoom and give me a thumbs up or actually give me a heart emoji if you're familiar with Google Jamboards, and give me a thumbs up if this is a new online tool for you. Okay, I'm seeing lots of hearts. Let me go to my next screen, see where we're at. Okay, so some of you it's new and some of you have been using that tool. But don't worry, we're going to explain it all to you briefly here and then give you an opportunity to practice before we get into our session. So I want to also say that we do have note takers and we may be asking for some additional volunteers. If you are not comfortable using the Jamboard tool, you are absolutely welcome to just unmute and speak aloud and we'll get those notes captured onto the Jamboard. We do encourage you to use a desktop or laptop computer if at all possible during the breakout sessions, as the larger screen will be easier for you to utilize the Jamboard tool. So let me just walk you through two key components of the Jamboards. On your screen is a snapshot of what a Google Jamboard looks like. When you go to your breakout room, your facilitators will put a specific link for your team in the chat box of your breakout room to join the boards that have been set up just for your discussion room. You only really need to learn two features of the Jamboards to use in the discussion. The blue arrow down the left side of your screen is pointing to a little box. That's called a sticky note. It's like a virtual Post-it note that you can write on and place on a virtual set of flip charts that we've created for the discussion questions. The sticky notes, if you click on that square box when you're in your room, an icon will appear on your screen and you'll be able to type in that box. And when you hit enter, it magically sticks itself to the board that you're on. It's that easy. The last thing I want to call your attention to is the second blue arrow in the middle of your screen where it says clear frame with a red circle and a line through it. Please do not touch that one button. Yes, Cole's doing timeout. Don't touch that button. It clears the whole frame for everyone, including us. So please never touch the clear frame, and you really only need to click on the sticky note if you want to add something in the box. And so now we're going to give you an opportunity to do a mini practice session, and I'm going to turn the program over to Cindy Stewart from our CADRE team.
Thanks, Anna, and thanks to everyone for being here. We're going to just do a quick little practice, maybe 15 minutes, just to give you an opportunity to, if those of you that are familiar with it, to refresh yourselves on how to use breakout sessions and Jamboards. I know this is a concept that might be new to some of you, so that's why we decided that we would give you an opportunity to do a little breakout practice session today. In the regular sessions, we will have a scenario read to you in your small group. Today, I'm going to read the scenario to you. It's a very simple scenario. You choose your breakout room. You can go to whichever breakout room you'd like to go to. I would ask you, please, to make sure that we don't all go to breakout room 1. I know we all love Rich, but you know, if everyone's in the same breakout room, it'll be more difficult to get through the program. So try and disperse yourself as evenly as possible. Anna and I will try and help do that. So if you get yanked out of a room, we apologize in advance. We're just trying to even the number of participants in each room. So facilitators, if you see someone in your room and then suddenly they're gone, it's because we put them in a different room, okay? Once you get to your breakout room and your facilitator starts your session, they will put in the chat the location of the Jamboard. So watch in your chat once you get to your breakout room for the location of your Jamboard. You'll click on that Jamboard link that's in your chat, and that will take you to the Jamboard that Anna just showed you the description of. The first page of the Jamboard has a list of all of the different personas or personalities, if you will, of the players in this particular exercise. For this session, there are 4 people. There's Pedro, he's in a wheelchair, there's different ones. and you pick one of those folks. The facilitator will then move to the next slide and give you instructions on how to practice using the sticky notes and pasting on the pages in the Jamboard. So at the end, we will come back to our main room, and Anna does that magically. You'll suddenly be in your breakout room, and then you'll be in your main room because she'll swoop us all back together. And at that point, someone from your group will do just a quick report out. And we're primarily, like I said, not necessarily tied to the scenario and to the exercise of the content of this as much as the opportunity to just practice using the Jamboards and getting into breakout rooms. So Anna, if you'll advance to the next slide, please. Okay, here's your scenario. You live in an apartment complex. Picture this. In the middle of the night, you are awakened by your neighbor banging on your door, telling you that you need to get out of the building. The apartment complex is on fire. Okay, so at this point, I would ask you, click the button that says breakout rooms at the bottom of your screen and go to one of the breakout rooms.
If anybody would like to stay in the main room with Sherry, that will offer the live transcript feature. This is Anna, and people are starting to join back, and we're going to do a quick debrief. And I understand we had a couple of technical challenges, but we're going to get through them all, right? That's what we have to do when we're working in a virtual environment. So thank you all for your patience with us. Let's do a quick little report out. Rich, how did your room go, and were folks comfortable with their Jamboards?
Yeah, our room was one of the rooms that had a little bit of technical issue getting it started. Everyone, when they tried to open up the link, was told to make a copy of it, and apparently it was directed into the trash bin, the original Jamboard. So thanks, Anna, for helping us out. Once we got that resolved, it was great. Everyone contributed and had some good ideas and perspectives for their personas.
Awesome.
And they added this is a very creative group. They added some twists too.
All righty. Well, we'll look forward to that discussion happening in a bigger way when we get going with this afternoon session. So thank you for your patience, everyone, with the tech challenges. Sherry, your room, I think, also had a few little technical glitches, but you got it going.
We did. Thank you for your help, Anna. Everybody was able to, look like everybody was able to utilize the Jamboard or verbalize what they wanted so that we could put their sticky up.
Wonderful. Thank you. And Ginny, any report out for us or comments?
Similar issue. I ended up also being the scribe for the group until we could get in, which was fine. I know at least one person was able to get in and drop in some comments from looking at the personas. It was interesting. I noticed that it did become harder and harder as we went through them to really think about how to get out of the building from the person's perspective. It was much easier to think about following the fire, the recovery needs. So I thought that was a really interesting thing that came up during our conversation.
Wonderful. And Liz and Marcia,
yes, there were the same technical issues, but Marcia was able to use her Jamboard and create and do the charting, etc. Everybody participated and everybody had their particular persona, and they raised issues for that particular persona of what would happen or what wouldn't happen. And we would be in deep trouble because they all raised issues that were not solvable at that particular moment. And they would be still in their apartments after 2 minutes.
Okay. All righty. Well, we're going to keep working on this. Bear with us, you guys. We're going to check all those links between now and the 1 o'clock session to make sure we resolve any of those little technical glitches that we encountered today, despite our best planning on getting this all together. What we have next are, I want to make sure we talk to you about what's coming up next. We will have a quick evaluation poll at the end of today's session for you to give us a little bit of feedback on the overall program for this opening session. You'll also, each time you exit from one of the symposium sessions, you'll have an opportunity to give us a short narrative comment if you'd like to give additional feedback. What's coming up next, as you know, is the session at 1 p.m. where we will get almost immediately into your small group discussions with the scenario and the personas and have an opportunity to really dig into the content. Day 2, we've outlined, starts at 9 and the keynote session at 11 a.m. And with that, I want to turn the program back over to Marcia. What I will leave up on your screen, I'm going to launch a Zoom poll in just a few moments. These symposium objectives are there just for you as reference. And I'm going to let Marcia go ahead and take over the last closing comments.
This is Cindy. I just want to thank all the facilitators for your flexibility and your ability to kind of jump in and do what we needed to do to get the session off the ground, even though we were having technical issues. So thank you all.
That's what we do, adapt and improvise and overcome. All right, next slide. Oh, it's my slide. Oh, shoot. Okay, 1 second. So what I'm going to do is share, and I do have it open. Thank you. Share screen. This will stop sharing.
And your poll should be launching. Are you seeing a participant poll? Okay. And Marcia's going to share with you a few other thoughts.
Yep, here we go. Okay, can you see my screen?
Yes.
Okay, so we want to share a couple of things with you, and by the end of the 6 sessions, you're going to be able to say this yourself because I'm going to do it every time. Okay, so the MyShake app, can you see all these other things, or you can just see my screen?
Just MyShake. We're
Stuff
good.
everywhere. So the MyShake app, it's a new app. It will give you an early warning a few seconds before an earthquake starts to shake the ground, which doesn't sound like a lot of time, but it would get you time to get off a ladder or step away from a big glass window. And so we want to encourage people. You can see QR codes on the screen that you can scan and download the app to your phone so that you have that warning. The message is only in English, but if you see this screen in any language, you know that an earthquake is coming and that you need to start to take steps. Now, tied to that, CADRE has received a grant from the United Way.
Earthquake. Drop, cover, hold on. Shaking expected.
That's what it sounds like.
Earthquake. Drop, cover, hold on. Shaking expected.
And okay, here we go. All right, and so tied to that, we've received a grant from the United Way since we're going to tell everyone that this app is available throughout Santa Clara County and let them know that the earthquake is coming, we thought that it would be a really good idea to create an earthquake safety training for individuals in their homes. It covers all of the basics of earthquake safety, and we are doing it in 7 different languages, and we will do more. 1, 2, 3, 4. There are more than 7 languages at the bottom of the screen. Every time we have a script, every time we find someone that is willing to translate the script into another language, we will record it and put it on our CADRE website in another language. So at some point through the end of the year, we're hoping to have bunches of languages that nonprofits and others can share with their clients, their congregations, so that everyone knows in their preferred language what to do at your home to stay safe and how to make good decisions about what to do after the earthquake. In addition to that, you can help us spread the word through your networks by either using these 2 slides and sharing this little bit of information on any meeting that you have, so that more and more people know that the resource is becoming available, or we can actually schedule live and Zoom presentations in all of these languages. So you can email earthquake@cadresv.org if you want more information. And that's the end of my commercial. And so this is My Linh. At the beginning, she was speaking in Vietnamese. She did ask those on the call, she told them that there was a $10 Starbucks gift card available, and that if they typed "I understand" into the chat, they would receive a gift card. Now, let's assume that this wasn't that this was an announcement that was presented in another language at the beginning, and that people all got it and they went in and they typed in the chat, and now all of a sudden, by the time you get the information in your preferred language at the end of the meeting, they're all gone.
Ooh.
That's isn't that frustrating? That even though we are in general translating information and giving it to other people, sometimes it's not in a timely manner, and sometimes they're missing out because we have a delay. She was also just having a conversation in general about preparedness, and mentioned Red Cross and Alert SCC and Catholic Charities, because we knew people would perk their ears up and wonder, what are they saying? But that's what we did, and it was a demonstration just to show how uncomfortable it can be for members of our community when we don't have information in their preferred languages. And that's a huge challenge. We're working with nonprofits right now to try to figure out a way to do things in more real time, but we're not there yet.
And Christine has her hand up.
Yes, Christine.
So, yes, so 2 things really quick. Adding to the conversation of language, let's also remember ASL.
Absolutely.
And let's also please remember that if somebody is using a screen reader and you're talking, having the screen reader read something plus having to try and hear you is like listening to 2 different radio stations. But if you were to present something to the public and the person was relying on screen readers to read out text, but you didn't have it in a format that can be read by screen readers, you're reducing their ability to function.
Thank you. That's great feedback, and that just tells me that when we're doing it, we are doing a version with ASL interpreter, so we will pause because we were planning to have a person speaking in English and doing while the interpreter is interpreting. So we will pause to give folks a chance to check the screen, and we are intentionally making sure that all of the images on the screen have alt text. I hope that's, if that's not enough, please let us know, because we're still learning this too. But we really do want to be able to work the bugs out and then share that information with everyone else so that it's easier for everyone as we go forward.
So this is Christine one more time really quickly. It's not so much on the Zoom screen as it is if you were to post something on a website, or if you were to share something in an app. Having that accessible to a screen reader is of critical importance.
Okay, we will make sure that that's happening. Thank you. That's why we're all here. We're better together.
And with that, it's 10:32, so I think we want to excuse you for a couple hours. We do look forward to seeing you all back at 1 o'clock.